recognize the member for Hamilton Centre.
Thank you, Speaker. Speaker, nurses are the backbone of our health system, and community nurses in particular have been critically underpaid for years. The Ontario Nurses Association is currently representing 44 primary care workers from the North York Family Health Team who are on strike because they are not getting the compensation they deserve. These 44 workers provide comprehensive care to 95,000 people, and they want to be back at work, but they need fair pay. Will the minister finally commit to closing the wage gap and ensuring that our community nurses and our dedicated health workers are fairly compensated?
Minister of Health.
Thank you, Speaker. I'm sure the member opposite appreciates and understands that it's actually not the Ministry of Health that negotiates with these individual clinics and nursing or agencies like community health clinics. What I can tell you is our government is 100% committed and supporting our nurses by expanding the number of nurse education positions that are available across Ontario. Since 2018, 100,000 new nurses have been registered and licensed to work in the province of Ontario. That is a government, under the leadership of Premier Ford, that is committed to ensuring that as our population grows, as our population ages, we are absolutely there to not only train and support existing nurses, but doing the work necessary to make sure that we have a sufficient workload to protect the people of Ontario. Thank you.
Back to the member for Hamilton Centre.
Speaker, the minister well knows that they have underfunded community care for years, and now they have directed hospitals to cut their budgets to the lowest they've been in years, which we know will need to lead to further layoffs and service cuts. The FAO has predicted that we may lose up to 7,200 hospital nurses by 2027 as a result. And if the minister hasn't been, anyone who has been to a hospital recently can tell you that we don't have a surplus of nurses as it is. Each and every nurse is desperately trying to fill the gaps that this government has left, caring for more patients than is considered safe and burning out because of it. Will the Minister of Health do the right thing, fund our hospitals adequately so that nurses across Ontario not only keep their jobs, but finally get the mandatory nurse-to-patient ratios proven to save lives? Yeah.
Minister of Health.
Thank you, Speaker. So will the member opposite, as we continue to invest, as we give for the last 3 years running an additional almost $1 billion to hospitals on their base budgets, will they stop voting against it in the budgets? Will the member opposite, as we expand nurse positions across our post-secondary institutions, making sure that there are more opportunities for young people to train in nursing and other critical healthcare workforces, will the member opposite and her party stop voting against those investments? Look, we are acting with our investments and showing very clearly that we are committed to ensure that across the province of Ontario, $2.1 billion investment in primary care expansion, and yet, Speaker, respectfully, the member and the NDP party continue to vote against those investments. Shame. What is the problem? Do you not support our healthcare workforce?
Order!